I am Dr. Franklin Yao with Vanguard Vascular Vein. In this short video, I will be talking about guideline-directed management and treatment of optimal medical therapy for patients with vascular disease. I will be talking about the vascular drugs that we commonly prescribe for patients in our vascular practice. Thank you for tuning in. I will have answers to all your questions coming right up. As a vascular surgeon, I specialize in the performance of surgical bypasses and vascular stents in the treatment of vascular patients. However, performing procedures is only part of what I do in taking care of vascular patients. All of our patients are managed with guideline-directed management and treatment with optimal medical management to prevent the progression as well as the recurrence of vascular disease. In fact, most of our patients are initially treated with medical management and only progress to vascular procedures if they failed a trial of medical management. In this short video, we will be discussing the most commonly prescribed medications for patients with vascular disease. We will talk about aspirin and plavix, which are antiplatelet medications, Eliquis, Xarelto, and Coumadin, which are anticoagulants or blood thinners, Atorvastatin, Simvastatin, and Rosuvastatin, which are cholesterol-lowering medications, and Cilostazol, which is a medication for treatment of symptoms of peripheral artery disease. Most, if not all, our patients with vascular disease are prescribed a daily aspirin. Multiple large randomized studies have shown that in patients with vascular disease, a daily aspirin can decrease the risk of heart attacks and strokes by up to 30%. It is safe, inexpensive, and effective. It can also help keep surgical bypasses and stents open. Aspirin works by preventing platelet cells in the blood from clumping together and forming a clot inside the artery. The addition of plavix significantly increases the effectiveness of preventing this platelet clot inside the artery, especially in patients who have had stent placements inside their arteries. The main risk of aspirin and plavix is bruising and bleeding, and should not be prescribed in patients with low platelet counts. Anticoagulants are another class of medications that are routinely prescribed in vascular surgery and is usually prescribed for patients who have blood clots, such as deep venous thromboses. The most common anticoagulants that are used are Eliquis, Xarelto, and Coumadin. Eliquis and Xarelto are preferred over Coumadin because of simplified dosing and the fact that you don't need routine blood testing, which makes it much more convenient for the patient to take than Coumadin. Eliquis and Xarelto are what we call factor Xa inhibitors. Factor Xa is a protein that's important for clot formation. Coumadin is an inhibitor of factors 2, 7, 9, and 10, which are clot-forming proteins. Coumadin's efficacy is dependent on a patient's diet, metabolism, and also interferes with other medications. So routine testing is important to adjust the dose for Coumadin. Taking anticoagulants is important for the treatment of patients with blood clots, such as deep venous thromboses, pulmonary embolisms, as well as chronic atrial fibrillation. The main risk for taking anticoagulants is in a patient who may be unsteady or at high risk for falling. Patients with vascular disease are usually prescribed a statin medication. The most common statin medications are Atorvastatin, Simvastatin, and Rosuvastatin. Statin medications are cholesterol-lowering medications that decreases the LDL cholesterol, which is the main risk factor for plaque buildup inside arteries. In addition, statins also stabilize plaque that's already there and prevents plaque rupture, which can lead to blood clot formation inside arteries. The goal of statin medications is to lower the LDL cholesterol to less than 70. The main risk of statin medication is the inflammation of muscles and the inflammation of the liver, and should be discontinued if these side effects occur. Multiple large randomized studies have shown that in patients with vascular disease, statin medications can lower the risk of heart attacks and strokes, as well as vascular complications by up to 30%. Another common medication prescribed in vascular surgery is Silastazole, which is the medication that we prescribe for the treatment of intermittent claudication or leg pain with walking in patients with peripheral artery disease. Silastazole is a phosphodiesterase inhibitor, but its mechanism of action and how it works is not well understood. Some studies have shown that silastazole may dilate arteries or may be a mild blood thinner, or may also help blood cells squeeze through tight blockages a little bit more smoothly. Silastazole can increase the pain-free walking distance in a patient with intermittent claudication by up to 30 to 50%. It should not be used in a patient with congestive heart failure. Guideline-directed management and treatment with optimal medical therapy is a standard of care for the treatment of patients with vascular disease. Antiplatelet therapy, anticoagulants, statin medications, and silastazole are the most commonly prescribed medications. Other medications that can be helpful but not discussed here include medications for the treatment of diabetes, high blood pressure, and smoking cessation. Please consult with your vascular specialist or your primary care doctor to see if these medications can be helpful for you if you have vascular disease. I hope that this video has been educational. Please check out our other available vascular videos. Thank you for tuning in.